Welcome to 7 Investing Now, a show that teaches you how to take a long-term view on investing by better understanding what's happening in the market now.
Good afternoon, good morning, good evening, wherever you happen to be. Apologies, I froze up a little bit there. Welcome to the Monday edition of 7 Investing Now. My name, of course, is Daniel Brooks Kline. I am being joined today by Simon Erickson and Dana Abramowitz. Let's just hit the ground running here because we have a very busy show. We asked people online what industry they expect is going to be disrupted, and the vast majority of people said healthcare. Simon Erickson even weighed in on our Twitter with healthcare. If you want to bring that up, Sam Bailey, we would appreciate it. So, and we'd also a little thank you to Genghis On. We're not going to get to those companies, but he seconded Simon's vote. And there were like 70 or 80 votes for healthcare. It was really exciting. So let's get to this right off the top. I'd love for you to explain, Simon, why you picked healthcare. And then, of course, we'll get to Dana, who can start to spell all of this out. And as always, we would love your questions and comments.
Well, first of all, Dan, I'm really looking forward to this show because I think it's combining one of Dana's favorite topics to talk about with one of my favorite topics to talk about in the same show altogether. But just to set the table a little bit, disruption is all over the financial media these days. But all innovation is not disruptive innovation. And so disruption is kind of this category where you have a very large percentage of consumers in an industry, perhaps even the majority of consumers, that are underserved or underrepresented by the majority or the incumbents' products, right? So when we think about this, kind of computing started with NASA getting these giant IBM mainframes that were just available for large government-funded missions. Now, of course, we've got personal computers, laptops, and smartphones as the computing industry disrupted itself. And this is kind of healthcare is the textbook definition of an industry that's ripe for disruption out there. We've got $4 trillion we're spending in America alone on healthcare. And for the most part, medical bills are paid for or reimbursed by insurance companies. And the burden of insurance premiums is paid by either private employers who are taking care of their full-time employees or government-sponsored programs like Medicare and Medicaid. And by the way, each of those is now bringing up an almost $1 trillion annual tab. So they're very, very expensive. And the entire system of reimbursement is also based upon the physician fee schedule, right? We're paying for procedures. We're reimbursing based on volumes for tests rather than necessarily the medical outcomes for the patients themselves. I know that Dana has a lot of opinions about that. We'll get into it later on the show, but the whole point is this is an industry that as a whole has kind of rewarded, expensive healthcare plans, people that can have access to the greatest doctors and the greatest healthcare out there. But we've got an underserved group of Americans, and I'm sure the rest of the world has this as well too, that really need a disruptive opportunity that will cater to their needs and make sure that we get good healthcare for everybody out there. So that's why I voted for healthcare in this poll.
Yeah, and it's worth pointing out that disruption is difficult. You're taking on incumbents. You're taking on a huge operating system. Dana, we're going to talk about innovation, but first I wanted you to comment a little bit on what Simon just said.
Well, yeah, I mean, the whole healthcare industry is adverse to risk, right? It's in their DNA, right? The Hippocratic Oath, do no harm, right? And so, they have a centuries-long tradition of, if it's not broken, don't fix it. I mean, like the stethoscope, it's the same thing that, to listen to your heart. It's the same thing that people have been using forever, right? It could it be improved? Probably, but there's no initiative, right? There's none of that disruption. But then I think that the pandemic has really pointed out the opportunity and people who are not getting access to healthcare, and just where we can really create disruption, just so that people have more access to it.
We're only as healthy as the guy making our burrito. That's something we've learned during the pandemic. Simon, before we get to Dana on sort of why innovation is difficult in healthcare, I wanted to get to the comment from Max Lucas. If you could read it, because your vision is better than mine, as we pointed out.
Sure. Yeah. Okay. So Max says, thanks again for watching, Max. It says, I know people think technology can disrupt any industry because how well it disrupted consumer goods. But industries like healthcare and real estate are hard to disrupt due to regulatory hurdles. Dana, how convenient. You just wrote a report on can technology fix healthcare?
Yes, I did. And so technology can help healthcare, but it can't be a Band-Aid. So if you have a technology company that, it's very easy to see, as consumers of healthcare, we can see where the system's broken. Every time I go to the doctor and, the nurse measures my blood pressure, my temperature, writes it down on a Post-it note, and then turns to enter it into the computer, right? I mean, those are opportunities to mess up, right? And, why can't it just, conveniently go into an EHR? But it has to be within the system. And then, the regulatory hurdles, certainly. I mean, that's, one of the biggest problems that the healthcare industry faces is that, there are all sorts of different government regulations, and it's at the federal and the state level. As well as, a lot of the, Simon had talked about, insurance and who's paying for things, that also comes from government. And, if there's an opportunity for it to change every 4 years, then, or 2 to 4 years, it could. So it just makes it really hard for the industry to respond to all of these regulatory changes, which makes it, difficult to make change in the first place.
It's also worth noting that this is a very large industry, and an enormous amount of training goes into obviously being a doctor, a nurse, a healthcare provider. And that tends to make you set in your ways. Like, I know, Simon, if there was a new way to look at stocks, we might be resistant to some of that logic. But I want to share a comment from James Bixler that just sort of made us all laugh, and let Dana talk a little bit about why innovation is slow. And here, Jason Bixler, I apologize. And he says, healthcare, they still use fax machines, for crying out loud. Even I don't have a fax machine anymore. Dana, I know you wanted to tell a story.
Yeah, no, so I had a story. So, I've been working in the healthcare industry my entire career. It's like 30 years now. And I was, talking to a head of oncology at a community hospital in Silicon Valley. So, a fairly innovative hospital. And, I asked, she said, if you want to, change healthcare, spend a day in the clinic. And so I did with her. And I followed her and I watched her sign out a patient, right? So, a patient's in the hospital, the doctor has to, sign that person out. So saying that they, are okay to leave. And she had a pen and a piece of paper and she signed, literally signed out. It wasn't using an EHR, right, an electronic health record. It wasn't, using any digital means. She actually had a pen. And just seeing that, here is this innovative organization that's still doing things, like paper charts. We have a ways to go.
We're going to take Luciana's comment in a second, but Simon, this is actually intentional in healthcare, right? They built this industry to make it, I don't want to say not disruptible, but slowly disruptible.
That's absolutely right. Healthcare as a whole has purposely put hurdles in place to slow the pace of innovation. All right. Think fundamentally about what healthcare is. Think about how many years it takes to become a doctor. You are an expert in your craft. And if all of a sudden the industry starts changing at a whim and everything that you've learned goes out the window, it would be impossible, right? You've got standard of care that is meant to be in place so that doctors can know what to do and how to diagnose and how to treat patients. If that's changing all of the time really quickly, it's going to be very difficult for doctors to keep up. Think about medicines. Think about how long it takes to get a new drug approved and go through FDA trials. It costs $1 billion in 10 years to get anything commercialized. That's on purpose because you want to reward the companies that have spent the time and done the rigorous research to actually have 2 years of exclusive patent protection so that they can actually recognize the fruits of their labor from all the work they did out there. And healthcare as a whole, I think that the regulations are very good. I mean, there's health for good reasons is people's lives that are at stakes here. You don't want this to be moving as quickly as cloud computing or the internet happens. But again, we see a lot of fundamental problems. And I think that there are definitely some big corrections that need to take place. Again, when you're talking about 1/6 of our GDP and $4 trillion a year, there's a lot of efficiencies we can realize out there.
Yeah, it's also steering a cruise ship. These are not easy changes to make. And I'll give an example from our lifetime. It wasn't that long ago that the vast majority of prescriptions were written on a piece of paper and you brought them to your pharmacist to fill it. Now, it's much more common to have that be done electronically, but it's not 100%. There's still a lot of paper prescriptions and pharmacies that aren't hooked up electronically, or I go to one CVS and they sent my prescription to another CVS and there's no interoperability there. So this can be really, really tricky. We would love your questions and comments. We're going to talk a little bit later in the show about some of the other areas you thought were ripe for disruption. But I want to start with Simon on this one. How do you sort of separate what's industry stubbornness and people protecting their own piece of the pie and what's actually something where we should go really slowly to not sort of upset the apple cart of, a system that sort of works, we're not all dead?
It's a good question of what needs to be innovated the most, right? And if you look at these pockets of healthcare, which by the way, when we say healthcare, it's like 1,000 different sub-segments, right? Or whatever we're talking about within this giant industry out there. But two that are, I think, necessary are oncology and prescription drugs. Oncology we're spending more than $110 billion a year on the fight against cancer. And it's very expensive. And a lot of the times we're just reactively responding to patients that are in later stages of cancer, right? Stage 2, stage 3, maybe even stage 4 cancer. What if we could proactively detect that earlier on? What if we could solve these problems that are hardwired into us as human beings through this blueprint we have called DNA to stop those problems from happening rather than reactively responding to them? I mean, that's one huge area that could be fixed. And the other one is prescription drugs. I mean, Medicare Part D, right? How much are we spending on treating chronic conditions with drugs over decades rather than correcting the fundamental problems? And we have opportunities to correct both of those now. Both of these big things have got technological innovations, whether it be gene editing, whether it be gene therapy, whether it be RNA interference, a lot of the work that even Dana did in her PhD work. The technology is out there and can be applied. But to your point about the narrative, Dan, this is a controversial field. When you say gene editing, there's a lot of kind of controversy that people, whether it's ethical, whether it's resistance to this for different reasons, whether it's privacy debates, people don't want to share their DNA or their healthcare records out there. When we talk about the pace of innovation, you've got to have buy-in from the consumers that are underserved. And a lot of those questions still remain to be answered.
And not every solution is a pill. And I think that's important to remember. And it's something I've talked about with Dana and Max Lott. And I'm going a little off script here, but I'm going to throw it to Dana. I can get back to interoperability. But I know that I went to the doctor and my blood pressure was edgy. It was sort of right at the edge of where you want it to be. And the prescription was walk more. Dana, your thoughts here on sort of non-medical treatments. Apologies if I jump out for a second there. I'm in Las Vegas for all of you who don't know. And the internet connection is designed to send you to the casino. It is clearly not designed for broadcasting. Dana, your thoughts on sort of like our quickness to treat a pill, to give people a pill, and to not say, hey, if you made these lifestyle changes, and I've made a lot of them, much less red meat, much more walking. Simon has sort of dared me to be here for the next 50 years. I'm trying to do that. Dana, that's fighting against sort of an establishment, right?
Yeah, no, it's interesting. There was a cartoon that I saw, and it's, all these people waiting in line for that, quick fix, right? And so we as a society, have been kind of taught, like how do you get that immediate result? And, a lot of times, like taking a pill, even if you're watching a late night commercial and, there's an ad for a supplement that's just going to melt fat away in minutes, right? And you think, oh, that sounds great. Sure, it's, $10.99, for 3 months in order to get that 1 month of dosage. But, like I'm going to do that because that's easier. Taking that pill is easier than changing my diet, changing my lifestyle, exercising a little bit more, meditating, sleeping more, just all the things that we know can improve your wellness. And, Simon had said earlier, about, moving towards prevention, right? So, like moving more upstream such that, we're not getting sick, such that we're identifying illness early before it becomes expensive and difficult to treat. So if we can kind of move to that point, I think that, we'll, like that in and of itself is disruption, but that is disrupting us as a society and not necessarily the industry, or getting the industry to kind of help us as a society. But we got to work together on that one.
It's taking the long-term investing approach to healthcare rather than the day trading approach. And Simon, this might be a good time for you to talk a little bit about our long-term approach at 7 Investing and how people might become a member. And then, of course, we will get right back to talking disruption in healthcare.
Yeah, absolutely. And I love that analogy. The long-term investing approach to healthcare is, just changing things for the good of the outcomes. First and foremost, if you go to our website, 7investing.com, you can get free access to Dana's report on whether or not technology can fix American healthcare. I think it's fantastic. Dana, like she said, has spent 3 decades in the healthcare industry consulting with CEOs. And she also has a PhD in biochemistry. So she's very knowledgeable about this subject. And we're offering her report for free on 7investing.com right now. It's only going to be available for the next week. So I recommend anyone who's not already a subscriber to check it out for free. If you are a subscriber to 7 Investing, you'll get it as long as you'd like this. We're posting it to the research tab of our website. And so please continue to check it out there. But to answer your question, Dan, you can sign up at 7investing.com/subscribe. Not only do you get access to great premium content like the reports on healthcare, but also our team's 7 best ideas in the stock market each and every month. I'm pretty excited. We just locked in our picks for next month, Dan. We've got, again, a really nice slate of options, some of them being companies that a lot of us had never even heard of before. So it's very exciting.
There's always 3 or 4 I've never heard of. $49 a month or $399 a year. 7investing.com/subscribe. We'd love to have you as a member. We have our new member call, our members only call, all this Friday. That is the best day of the month. It's a busy day. It's a multiple coffee type of day. It is a marathon, but it is a ton of fun because we get to interact with our members. We get to talk about things we don't talk about on this show. We would love more of your questions and comments. Luciana, I promise we will get to yours before the show is over. Dana, I want to talk about interoperability. You mentioned this word. Why don't you explain what it means and sort of how it can be disruptive in the healthcare space?
Yeah, so I've mentioned electronic health records multiple times in this call. So just basically data and who has it, right? So if you go to for one doctor, say your primary care physician, and you have all your blood work and all of your data is in that physician system, and then say you have a endocrinologist that you're working with. All of your, you go and you have different tests, and all that now is in that doctor's system, right? Your data does not talk amongst the different doctors, even if they're in the same network. That they may not have that. So that is the interoperability of sharing data, healthcare data. My car gets better service because I've always taken my car to the dealership. So when I was living in California, it was there. Now that I'm in Texas, it's here. And my dealership here knows exactly how my car has been treated throughout its entire lifetime. That doesn't happen in the healthcare system, which is really unfortunate, right? And a lot of it, is who owns the data, right? Is it your physician, because or is it the patient? And a lot of times the physicians don't want the patient to own it because then they can go to different physicians, right? But it ultimately is the patient's data. So there's a lot of discussion on, who owns the data, the interoperability. As a patient, you have your right to your data. So if your physician isn't, complying and giving you results, you can tell them that they should. I'm a big advocate for making sure that patients have their own data.
And of course, there's a technology aspect of that because we have to move our data around privately. I don't care if somebody knows that my car needed an oil change. There might be health issues that you don't necessarily want to be public shared. Simon, you think we should actually change how some of healthcare is incentivized? Do you want to explain that one? Because I found it really interesting.
It's a really interesting one for sure, Dan. Dana talks a lot about value-based care. And we just kind of discussed already the physician fee schedule and how we're rewarding for reimbursements for procedures rather than outcomes. If you want to change the system, you kind of start with what you define success as, right? Right now, success is you completed a test, we're going to reimburse you for the test, let's move on. And doctors are saying, hey, we're going to cover ourselves. We don't want a malpractice suit on us out there. So let's run as many tests as it takes to show that we did what we were supposed to do. What if you can move that proactively to say, hey, really what's most important to me is making sure that this patient is okay, and the medical outcomes are the very, very most important things. And so that's why we've seen the CMS kind of pushing for value-based care, right? And insurers have picked up on this. United Healthcare, largest insurer in America, has said, yes, we want to transition where we're rewarding the outcomes, and we want to keep people healthy. A gentleman I have chatted with for several years named Donald Brown, used to be CEO of a publicly traded company called Interactive Intelligence, now is running a new company called LifeOmic, which is trying to encourage exactly what Dana mentioned earlier in the program: keep people healthy. 50% of health is just are you staying physical? Are you taking care of yourself? What are the activities that you're doing? But it's really, really challenging to change lifestyles for people. And even he who started a company to try to encourage some of these behaviors has said to me, hey, this is a really, really challenging problem. It's very personal. You can tell people to eat healthy and go jogging every morning, but it's still up to them to do that. Now, the interesting part is going to be if you start rewarding financially the people who are insured. If you give them rewards for staying healthy, for doing things that they want to nudge you to live a healthier lifestyle, I think that's one thing that might change the equation a little bit when it comes to the insurers and the payers of this.
So Dana, one of the things I do is I share my Fitbit or Apple or whatever I happen to be wearing data with my trainer, and he sort of makes suggestions and tells me things to do. Are there ways we can sort of incorporate health and that type of monitoring in a non privacy violating way with our healthcare providers, where maybe I actually pay lower rates because I have lost 20 pounds and I do walk 10,000 steps a day, and all things I'm doing not so I look better, but so I actually live longer. Like, that's my goal.
Absolutely, yeah. So we have wearables, and there are insurance programs where they'll give you your insurance company, or your company will give you a health fitness tracking device, whatever it is, and incentivize you to do different activities. There are also different wearables that'll share reports to your physician, so that you're collecting data, and that's not just your steps and your physical activity, but now there are wearables that can monitor blood pressure, heart rates, like a whole suite of life biomarkers that you can share with your physician to help track your health. And we did talk with the data and the interoperability. There is the data protection, right? So there's HIPAA laws, which is the portability of data, right? And there is a privacy component of that, right? So you can share data, but you can't. Your personal medical information has to be separate, right? So an anonymized heart rate or blood pressure doesn't necessarily mean anything, but that it belongs to me and where I live and what my phone number is, and that obviously that's more personal. And so that's the PMI that you might hear when people are talking about HIPAA law complaints.
And if I might add to that too, Dan, we have seen as investors a lot of flops when it comes to consumer-facing healthcare, especially for medical devices. If Fitbit was not a good investment, right? 23andMe kind of got exposed that it wasn't medically actionable, right? Under Armour tried to do MapMyFitness and have devices you put on. That was a big flop and a waste of money for them. We've seen a lot of failures in this because it was always just kind of this fun, neat to have data that was, you could go out and you could track how many steps you were doing every day or what your heart rate is, but it wasn't something that was really tied into your doctor that was being reimbursed by the insurers. And I think that the necessary step to kind of make this more personal, make this more tied in with your insurer, with your employer, I'm starting to see those happen where we didn't see those maybe 5-7 years ago when a lot of these companies were trying to front run where this industry should have been heading.
And it has to get better. Dan, I'll go to you in a second. My Fitbit needs to know that I'm walking, not moving my arm a lot during a show, which it doesn't know. So that is absolutely an issue. Dana, I stepped on you there. My apologies. Go ahead.
It's fine. So, a lot of times with these devices, and this is the problem, is that, it's a shiny object, it's new, and so you want to use it, but then after a while, you stop using it, and it ends up in your drawer, right? So it, and this is why, a lot of these businesses, weren't great investments, because they were, great and new at the beginning, but not great for the long term, because people weren't using it for the long term, because there wasn't that long-term lifestyle changing. So, back to Dan's comment on, like, how do we get healthcare to be more of a long-term investment rather than, just a day trade or, just like a short-term, couple of weeks until we get bored and, something else new pops up and we want to try that.
Yeah, and walking 10,000 steps a day is better than walking 200,000 steps once a month. Like, there's a lot of benefit to that. I want to take a comment from Bill Clock because it speaks to something Simon wants to talk about. We don't need to talk about the specific companies, but he says screening companies seem to be the most disruptive. Simon, you wanted to talk about how identifying things really early on, you've alluded to it earlier, but this could be, I don't want to say the holy grail, but a major part. If we catch cancer on day 1 instead of day 200, that makes it easier to treat.
Yeah, sure. And so that speaks exactly to one of them that Bill brought up here, right? EXAS is Exact Sciences, which is doing an at-home diagnostic for colorectal cancer. I mean, that's something that's a lot different than having to go into the hospital, wait for results. So you can basically just send by mail a diagnostic test like that. NanoX, same thing, trying to do things that are more disruptive to the system right now. The system itself wants to move slowly. You've got to show progress. We still need to look at the right metrics as investors to show that these companies are executing well. But I think that they're heading in the right direction. I mean, if we really are going to have consumer-facing healthcare, let's have consumer-facing companies who are innovating in that field.
Could we disrupt the colonoscopy? Someone's had to go through this a couple of times. This feels like one that is ripe. There'd be public demand for a better, easier way to do this. I'm being silly a little bit because obviously that's a fairly invasive procedure, but there's a lot of room with a lot of these to do blood-based testing, to do other genetic marker testing, things where we could figure it out beforehand. We appreciate your questions and comments. Dana, feel free to jump in.
I can comment on that, right? So, there's, a lot of the regulations, so you have that basic gold standard, right? So a colonoscopy. If you have a screening test that can, and the company shows that it can provide that same level of standard as a colonoscopy, that can become adopted, right? And we are doing that a little bit, with some tests. You get screened, and then like if you get a negative result or like a questionable result, then maybe you come in and have the more invasive test. But we are actually getting to that point, and I'm thankful for that as I'm getting up in age. So.
Yeah. Well, and diagnostics data, like you said, it's all about selectivity and sensitivity, right? You don't want to have false negatives, nor do you want to have false positives, where a false negative is saying, hey, we missed it, you're fine, there's nothing there, when there really is, or a false positive where they identify something that really is not a concern. Obviously, both of those are really bad if you have the wrong diagnostics, so it's super important, even if it's cheaper, to keep the same standard.
Yeah, and we've seen a lot of that with COVID testing, where false negatives gets people locked in their hotel rooms until a better test comes out. I want to talk about one of the disruptors we're already aware of, and that's telemedicine. And Simon, you can take this first. Has telemedicine already proven to be a disruptor?
I think parts of it are, Dan. In terms of somebody who really nerds out on disruptive innovation, I would not consider this to be by the book disruptive, at least for telemedicine. It is great. We want to move people to their homes and just have the calls with their doctors take place at home rather than having to go to the hospital. The downstream of that too of pharmacies is very important too. I know that Dana chatted a couple of weeks ago for our podcast with someone who is delivering prescriptions directly to people's homes. All this is very innovative. The disruptive part to me, though, is actually in the wearable devices themselves, who can collect data points and send that to your doctor so that you can proactively diagnose things and say, hey, red light, something's out of whack here. Let's come in for an appointment or do a telemedicine appointment. Rather than retroactively saying, hey, I don't feel good, I come in and then you diagnose the symptoms. So I think that's kind of connected to telemedicine, but it's in really more of the wearables segment of that, at least in my opinion, is the disruptive part of it.
Dana, your thoughts here?
Yeah, so I think for me, the disruptive part is the convenience to patients, right? So getting the healthcare industry to treat patients as consumers, right? And I think that that's what telemedicine does. It gives people access to a doctor, conveniently when they need it. A lot of, if you're sick, sometimes you call your doctor and they can't get you in right away. But, you call, book an appointment on Teledoc, and then you get notice, like, hey, a doctor's going to call you in 10 minutes. Make sure you're ready. Right. And so, like that convenience. And so disrupting the healthcare industry in a way such that it's more like we expect, other retail or other, types of industries that we interact with, and that convenience that we get from it. So it's, that's just a different way to look at the disruption, I think.
And telemedicine a lot of times solves a problem where you already knew the answer. My son had allergies, he needed eye drops. Telemedicine made a lot more sense than going to a minute clinic. I want to take two comments, one from Daniel Delgado, one from Luciano. Simon, I'll let you read those and sort of lead the discussion there.
Sure, yeah, Sam, if you can put one of those up and I'll read whatever you put on the screen. Okay, yeah, Daniel, fellow Houstonian, thanks for watching the program. Apple Watch tracks a lot of health information for individuals, especially when walking. They are so much at my fingertips. I use the info to achieve my health goals. I do show my doctor my Apple Watch health activities and my tracking results. Great info to share. Dana, that sounds like A+ from Daniel. That's what you're trying to achieve out there, right?
Yes. Yeah, no, I have an Apple Watch. I love it. And yeah, I mean, like, using it and having that reminder, sharing that information with your doctor. And then, it really just becomes a lifestyle thing, right? I mean, the nice thing about these smartwatches, and how Fitbit has expanded is that it's not just tracking steps. It's not just a pedometer, but it incorporates other things so that you might be more apt to wear it. And then if you're more apt to wear it, then you have this reminder on your wrist or wherever it is that like, oh yeah, maybe I should walk, take the stairs instead of the elevator, or park my car a little bit further away, or just be a little bit more active. And the Apple Watch has little reminders to like stand up every so often, or to breathe if you get a little bit stressed. It can sense all those things, and those are good things to promote that whole wellness, well-being.
My Fitbit is nearly as much my boss as Simon is. I often have to walk around the room because of the Fitbit. Have you
trained it with my voice yet, Dan? Does it talk to you in my voice when it's telling you to do things yet?
It doesn't talk.
Okay.
And I've bought all of the devices, and I've struggled with what the right one is. So if anyone on the team wants to try a device, I have more than a few I could send around. Why don't we take EB Capital's comment, which is, of course, our friend Todd.
Oh, yeah.
Simon, if you want to read that.
Yeah, what's the best wearable innovation? Maybe automated insulin devices. Oh, okay, yeah, with pumps replacing some of the existing standards out there. Any thoughts on that one, Dana? That might be a...
Oh, yeah. So my boyfriend has type 1 diabetes. So I am up close and personal with the CGM nowadays. And so yes, I have friends who, have been dealing with diabetes for their lifetime, and it certainly helps. Is it 100%? Like there's still, calibration that you have to do. There are still times when, sugar's high, sugar's too low. It's definitely, so I don't use one personally, but, my boyfriend does. And, from his experience, yes and no in terms of good, but like certainly giving freedom for parents of children with type 1 diabetes, absolutely. Just the fear of a child having a low and going into a diabetic coma. I mean, like these for real are serious things, and I've heard stories of parents sleeping in their child's room because they're not sure that they're going to wake up just because of their blood sugar. So absolutely, that has helped, and that's a chronic disease that people have been living with for generations, and I'm happy to support those organizations that are working on the research and helping to make that better.
Dana, are we on the cusp of more meaningful health monitoring, like for everything from blood pressure to, to insulin levels to whatever else you might need to track on a regular basis in a meaningful medical way?
Yeah, yes and no. I mean, I think that there are, so with CGMs, and we've talked about this before, if it's a medical device, right, it needs to be treated and regulated as a medical device, and make sure that you have the testing to know that it, is meeting your gold standard, especially if people's lives depend on it. I think that, like for my Apple Watch, if my heart rate, is a little bit off, for the most part, it's not going to matter. But, like if I have an arrhythmia, then, like that, and it's sending warnings to my doctor, then, if it's off, then that could be a bad thing. So, I mean, we're getting better, but, a lot of the commercial, recreational trackers, it's a fine line between, being a medical device and, just being for fun.
Dana, can the anecdotal information be useful? I track my heart rate too, and I prefer the Fitbit, which gives me a daily average rather than the sort of real-time data. That can be valuable, right?
Oh, absolutely. Yeah. I mean, and there have been studies that have, talked about, like having, like heart rates, your blood pressure, just having all of that information and, tracking it and how that, provides that overall view of your health. And, going back to the prevention, right? So, longitudinally,
I'm not sure.
Right, so that long-term investment, a change, and that change.
I'm sorry. Go ahead.
Yeah,
Dana.
and
It sounded like you cut off for a minute.
Oh, sorry. Yeah, no. If that, if you're tracking over time and that change adjusts, then that could be an indication that something's different, and you should look into. So, I do think it's a good thing.
Yeah, and Dan, if I can add to that too, I mean, just think about what we said. 50% of health is lifestyle, right? And who's collecting more data about you than anyone than the smartphone makers? So when we're talking about Apple Watch or your iPhone that's in your pocket, they already know your web browsing history and where you are. If you have more apps that you download in the App Store, that gives now information about how you're sleeping or your heart rate or blood pressure and things like this. More and more, we're feeding these devices information that could be useful. And you're starting to see kind of a decoupling. A lot of these companies, this is why Apple keeps talking about healthcare as its final frontier that wants to approach this. If you've already got the data, the next step is how do you get the algorithms? How do you get the AI that's going to fine tune that to say, hey, you've got a risk right now, and we're going to tell you, you need to go to the hospital. You want to make sure that you're right, that you're not sending people unnecessarily, and we're causing a lot of confusion out there. But if you can crack that, that's the trick to being proactive to healthcare. This is why you see device makers, not just wearable device makers, but smartphone device makers, so interested in healthcare.
So you've actually seen Apple Watches tell people your heart rate is doing this, go to the doctor. Simon, is this a slow disruption? Because Apple knows where it wants to go, but it's not going to get there for like 5, 6, 7 years maybe?
Again, the pace of innovation depends on how embedded it gets with the hospital. Right, we are already starting to see companies that are working with hospital with health providers, with health networks. We won't talk about those too much here on this show today, but you're already seeing hospitals saying, "Yes, I am embracing that. You know how to use AI on this data that you're collecting out there." That's going to be the question, Dan. It could be a couple of years, it could be 5 years, 7, it could be 2 years. We're already starting to see it. I know that as a patient of any hospital that I go to, I want the hospital that's going to be right and is going to be proactive. And we're starting to see some of that out there already.
Yeah, the hospital that's wrong most of the time is not a successful hospital. We've got a couple of more comments. We were going to do more on this show, but I think we're just going to keep it to healthcare. We'll get to all the other things we wanted to share later this week. But Simon, you wanted to take Luciano's comment.
Yeah, I like this one. I mean, Luciano writes, is disruptive a word that's thrown into market a company or a stock? Seems like this nowadays. And that's so true, right? I mean, so many people are just identifying being disruptive with doing something differently, right? I remember hearing Chipotle was completely disrupting the restaurant chains, when it was offering a new menu that wasn't out there. Disruptive is a very specific thing. You need to look at what management is doing, whether or not the marketing folk of a company are promoting a company as being disruptive is very different than if they're actually going after an underserved segment of the industry. And if they're making progress in this very difficult to topple environment that's been owned by the incumbents with their higher margin products for years, I mean, that's what's disruptive out there. I would agree with you, Luciano. It's being used way too often in the media these days.
Yeah, replacing food with like a nutrition pill is different than making a burrito more efficiently. Right. Dana, did you want to weigh in here?
I work a lot with startups as well, and it seems like every startup in their pitch is talking about how they're being disruptive. So I totally agree that word is often overused.
We'll let Bill Plock have the last comment here before going to Simon and Dana for a wrap up. Simon, if you want to read that comment, I'd appreciate it.
Yeah, thanks, Bill. My new Tempur-Pedic bed sends me alerts about my sleep patterns. I'm not sure about its accuracy, though. Your wife says you snore more than it says. Funny comment on that one, too, Bill. But yeah, that's great. You're starting to see the apps pick up out there, huh?
It's important to remember that these are not diagnostic tools. These are tools we might use to identify when we need diagnoses or proper tools. A sleep study in a hospital cannot be replaced by your Fitbit or your bed, and that is important to note. Simon, let's just wrap up a little bit. Some overall thoughts on healthcare and disruption, then we'll let Dana do that, and then, of course, we will hit our finisher.
Yeah, again, so I mean, when I look at checkboxes, back to full circle, your question of which industry is in need of disruption out there, I see that healthcare, we're spending $4 trillion a year on it right now. The majority of the system is reimbursing based on procedures and volume rather than on patient outcomes. And you've got a large percentage of the population that is either underserved or has to figure out health insurance on their own if they're not employed full time. This is in concert with the gig economy, where a lot of people are taking on side hustles and doing part-time work or consulting as well. And so we've got a huge challenge. It's not going to happen overnight. We're not going to fix healthcare, and this is just going to snap our fingers and fix it. But I think that there are some pockets of very disruptive innovation that are taking place, whether that's in the technologies themselves, and we talk about gene editing, whether you talk about disruption in the payments space of how we're reimbursing things like that, or whether we're kind of just encouraging people to be more consumer involved and taking charge of their own lifestyles and their own health too. I mean, all of those are very disruptive from where we stand today. It's a fascinating industry. It's one that has a lot of my attention. I know it's one of Dana's favorite topics as well.
Dana, solve healthcare. You have 45 seconds.
I'm working on it. I'm working on it, Dan. This is one of the reasons why I went to business school. It's just, I had told my doctor, I want to change the healthcare industry, and I'm trying, right? And I'm not alone. Thank goodness. It's not something that just one person can do, or teams of people. But we are making progress. There is innovation, both at the government level and in different hospital systems. We're seeing that, in value-based care. I've written some stuff about that as well. Simon can tell us whether or not it's publicly available. But yeah, we are making progress. But then, we have, as consumers of healthcare, we have the opportunity to disrupt it, just by, the things that we do, considering our health, the health of our communities, taking care of our bodies, listening to our bodies, moving our bodies, feeding them well, letting them rest when they need to, all those things, and being proactive, like doing all those screenings and all those, unpleasant things, those are things that we need to do in order to kind of be prepared.
Getting information out there is really important. I've made a lot of meaningful changes because of Max and Dana. That's not how it should be happening. It should be delivered from somewhere else. This is totally unrelated. We appreciate the healthcare discussion, but the finisher is usually something we post on Twitter before we figured out our topic. So I apologize that this is completely unrelated to the topic at hand. Sam Bailey, if you want to pull up our finisher, and Simon, I'll let you read it.
Sure, yeah.
Oop, and it does. Maybe we're having some technical glitches there. That seems pretty much right for the day, so not a big deal. We could skip this one. Simon, why don't you read Daniel Delgado's comment to close out and then tell people how they can get in contact with us.
Oh, bear with me 1 second here, Dan. I can pull up our finisher, even though we can't show the screenshot of it itself. If you do bear with me 1 second, it says that you asked which entertainment company has the biggest upside, Netflix, Walt Disney, WWE, or Comcast. And the overall winner, Dan, on that one was Walt Disney. They got 70% of the vote. I think that it's probably you would be the best one to speak about that vote result. Though, right?
Yeah, it's overwhelmingly Walt Disney. A lot of people wrote in Viacom CBS, and here's the reality. This is an IP game, and Viacom CBS has done a really good job with monetizing, but they don't own any good IP. Their best IP is like Star Trek and SpongeBob. It's not great. Disney is number 1. Comcast is like number 17. That's how different this industry is. So yeah, overall, Disney has dozens, if not hundreds of exploitable hits. And going forward, they are going to be the absolute winner. Simon, how can people get in touch with us?
Yeah, great. So thanks again for everybody attending this show. This one was a lot of fun for me. I know that this is a topic that I get pretty excited talking about, Dana as well, since she spent 3 decades in a career in healthcare. I think that if anybody who really wants to invest in healthcare, I'd really, again, encourage you to check out Dana's report. It's right on 7investing.com. You can see it right at the top of our homepage. It's Can Technology Fix American Healthcare? We're going to feature that only for a few more days. So if you're not already a 7 Investing subscriber, go check that out. Dana not only has a great report, but has 7 things we need to diagnose to fix in healthcare, and then even 3 stock ideas at the bottom of it too. So really, A+ on Dana's report. Go check that out at 7investing.com if you have not done so already. And if you want to see our recommendations from the team, not only the content we're providing, like those reports, but also the actual stock recommendations. Each advisor on this team comes up with our very best idea every single month. We lock those in, and then we release them on the very first of each new month. And so we got a couple weeks until the 1st of September kicks in here, Dan. But I'm pretty excited about the team's ideas, and you can check those out at 7investing.com/subscribe.
And if you'd like to get in touch with us, it is info@7investing.com. That is questions about the service, questions about your membership, anything you want to know from us. But of course, don't ask us to research like, some penny stock we've never heard of. That's a little bit over the line. But, questions, if you're a member, we'll funnel them into the member call if they're on past recommendations. And if you want to interact with us publicly, we are at 7investing. That is the number 7 investing on Twitter, and we are always fun to follow. Apologies for any internet issues. I know Dana had some. I know I had a couple. I don't know why the internet doesn't work better. So for Sam Bailey, for Simon Erickson, for Dana Abramowitz, I am Dan Kline. I'm in Las Vegas. I will be back on Wednesday. We appreciate so many of you watching. Thank you.